Let's talk about numbers, because you've spoken about cases as a metric and testing. And I want to talk about this. I put out a video a couple weeks ago talking about the numbers that we get thrown every day in the UK media. We get positive test cases, we get hospitalizations, and we get total deaths. And those are the three numbers that are on the Guardian newspaper front page every day. And I want to get your thoughts on them. First of all, you've said before that it doesn't make any sense to look at cases from a scientist. You've said don't test anyone under 18. You've also said more tests equals more cases. Maybe you could talk more about this idea. Also, a positive test, all it means is that it tested positive for the COVID-19 test with whatever threshold happened to be doing. And I'm not going to get into the test itself, which I don't think was designed for COVID. But tell me your thoughts on how we can understand these numbers better, Doctor.
Yeah, so if you test a lot of asymptomatic people, like school children or university students, for example, you are going to find positive cases, even though they're not sick, but you're also going to find a lot of false positives. So if you then, as they do in the US, they use that to close schools or send the students home, that's very damaging to these children and these students. So that's sort of a nonsensical from a public health perspective to do all those testing of asymptomatic people.
You mentioned false positive really quick. Can you just explain to people what is a false positive test and what do we think the percentage is on it's the PCR test, I think, for false positives?
False positives is that the test, and this is not just the COVID, this is for almost any medical test. You will have some who test positive even though they're not truly are positive. You can also have false negative where somebody tests negative even though they have the disease. So that is common, but even if that's very low, suppose it's only 1%. Well, if you test a lot of people, that still adds up. And if you're in a hospital setting where you treating patients, then having a few false positive is not a big issue in a treatment setting. On the other hand, in a surveillance setting where you mass test asymptomatic people, then even a small percentage can create a lot of damage because you're misdiagnosing a lot of people as positive even when they're not.
Right. And I've heard also the false positive could be as high as 20% or 40%, and it could be even higher.
Yes, I don't want to give a specific numbers, and I think it can depend on the exact tests that are being used, because there are different tests for COVID-19, and they probably have different false positive rates. It also depends on which is the population that you are testing. If you're testing people who are symptomatic versus asymptomatic, you're going to have a different false positive rate.